Good evening. My name is Marcus Horner, and this is my video presentation for Professor Rossi's English Comp 2 class. Tonight we'll be discussing what causes multiple personality disorder. A century ago, two key persons in the history of dynamic psychiatry, Sigmund Freud and Pierre Janet, were influenced by dissociative phenomena and began creation of theory behind minds with very different orientation. Dissociative disorders, more commonly known as multiple personality disorders, have many causes which may produce various symptoms with highly fluctuating levels of severity. Dissociative disorders are characterized by an involuntary escape from reality, characterized by a disconnection between thoughts, identity, consciousness, and memory, as defined by the National Association of Mental Illness. There are three types of dissociative disorders with multiple etiologies. There are multiple conditions related to dissociative disorders that can have similar signs and symptoms. Some disorders may require long-term continuous psychiatric evaluation and treatment to maintain a normal life. There are three main categories to dissociative disorders. Dissociative identity or multiple personality is one that we more commonly tend to think of with this type of mental illness, as this is the illness that can cause an individual to take on the roles of a completely different person. Other characteristics can include hearing multiple voices within one's head. These voices can have different names, characteristics, and personalities. These changes in personalities can leave the person with gaps in memory and leave them unable to recall everyday events, personal information, and even traumatic events in their life. Another form of this is dissociative amnesia, which is usually linked to a traumatic event in one's life, such as combat or abuse. These events can last for minutes and, in some rare cases, years. Depersonalization disorder is another mental disorder closely related to multiple personality disorder. A person experiencing this will describe feeling as if they are watching their life in a movie. These individuals will struggle to distinguish delusion from reality. There are many conditions related to dissociative disorders that can exhibit similar signs and symptoms. Many of the conditions closely related to dissociative disorders are considered so due to an extreme symptom of said disorder, leading to dissociation, as well as a plethora of other similar signs and symptoms. Anxiety and depression are two closely related disorders that can be a predisposing factor to more severe psychotic disorders. These two diseases alone affect more than 27% of the U.S. population. The disorders, if left untreated, can lead to more severe psychiatric issues. Borderline personality disorder is a psychiatric condition that affects approximately 1.4% of the U.S. population, with 75% of those diagnosed being women. Post-traumatic stress disorder affects approximately 3.6% of the U.S. population. 37% of those cases are considered severe. Many individuals resort to substance abuse to cope with the harsh effects of mental illness. This creates a dual diagnosis situation, forcing intervention for the substance abuse and the underlying medical condition simultaneously to attempt to achieve any type of normalcy. All psychiatric disorders closely related to dissociative disorders require extensive treatment to overcome. Sadly, many continue to relapse for different reasons, from failure to continue psychotherapy, refusal to continue medications, or reverting to substance abuse in an attempt to self-medicate, only ending in further crisis. There are multiple disorders of varying origins. Many can be linked due to similarities in diagnosis and treatment. And while not all can be helped, more extreme cases of mental illness require extensive professional skill and care to find a happy medium to life.